Hello, my name is Brittany Schell. I'm a registered nurse and a licensed practical nurse instructor with Vancouver Community College. Today, I'm going to be discussing Classroom Assessment Technique 16 from Angelo and Cross's textbook, which is concept mapping. Let's get started. What is a concept map? There are many different ways to do a concept map, which is a tool used to assess and develop metacognitive skills. It's a visual mapping of mental connections between different concepts that the instructor is trying to teach. It's based on a more constructivist philosophy of learning, where students continually build on their previous knowledge. Neurological research has shown that these concept maps help create strong neural connections in the brain that can be relied upon to be activated during decision making, which is a topic I'll get into a little bit later. In terms of where this technique would work best in the classroom, I've related it directly to nursing. Concept maps can be used to help with concepts such as pathophysiology, linking risk factors and signs and symptoms to diseases. It can also help with leadership and organization of planning for students, care planning of strengths and weaknesses for patients, as well as curriculum planning and structure as educators. Because concept mapping helps to create those strong neural pathways, it helps students develop their critical thinking, which has always been an important part of nursing and nursing education. Concept mapping helps students become aware of their own critical thinking process and helps to improve upon it. There are a few limitations to concept mapping, as mentioned in Angelo and Cross's textbook, such as comparisons between students can be difficult to make. It shouldn't be used as a grading tool. Each student will create a concept map that makes sense to them, so no two students will look exactly alike, unless you start to place restrictions on the maps, which can cause it to lose some creativity. Another limitation is that students who may excel in verbal skills may have difficulty with this assessment tool and may not be as graphically skilled. They could find it frustrating and question the value of the tool itself. There are definitely more advantages than disadvantages for concept mapping. For instance, it's a skill that students can use in every classroom, not just a core nursing class. They can use the technique on their own as a pre-writing tool, for note-taking, or as a self-assessment process. It's very low-tech and is a way to get a graphic view of a student's association for topics. This can be used to help instructors realize where we need to spend a little bit more time with different concepts. And current research is very positive in terms of using mental maps to organize what we learn. As mentioned previously, it's related to those strong neural connections that are made when we link information in a constructivist fashion. So what are some best practices? There's a slight difference between concept maps and mind mapping. Mind mapping tends to be much less organized. All of the information is thrown on a page in bubbles or boxes, and a few lines that connect the thoughts. Best practice with concept mapping is that there needs to be an order to the information. This can be done in a top-down approach, with the broader topic being at the top, or it can be done in a color coordination fashion, such as I've done here. In terms of how to provide feedback, this can be a little bit difficult as again, no two students will be exactly the same. As an instructor, depending on the topic, I would request that a certain amount of points be required per branch. For example, depending on the complexity of the disease, I could tell the students that they should have at least 3 points regarding the pathophysiology, and they should have 5 different risk factors, both modifiable and non-modifiable. For their first entrance into concept mapping, I can help by providing outlines that start to show how to organize information, encouraging creativity if the students want to try it a different way. Here are a couple of different examples. For fluid volume excess, this was done on the computer in more of a box fashion, and it points out specific complications, some clinical manifestations, nursing interventions, lab diagnostic studies, etc. Another example found is a COPD. Again, it mentions complications, some signs and symptoms, some risk factors, possible nursing diagnosis, etc. Feedback will definitely be essential the first few times they create the concept maps, until students have a better understanding. Since we are split up into smaller groups in lab and clinical, this would provide the best option for sitting down and going over their concept maps one-on-one to provide feedback. Another way to conduct feedback for students is to have the students repeat the concept map at a later date and have them compare it to their first one to show the level of knowledge that has been gained. This can also be used as a self-assessment process. And finally, here are some references that I used while researching this topic. This is my first time using Coggle for the concept map itself, and I highly recommend the tool if you'd like to do a concept map on the computer instead of hand-drawn. I hope this helped to explain the topic of concept mapping more, and I encourage you all to try it in your classes. I've had great feedback from my students so far. Thank you.